Today we will be talking about the active straight leg raise test. This test is used to assess your hamstring flexibility. The hamstring is being tested due to flexion at the hip and knee extension. The muscles that are attached are the ischial tuberosity for the biceps femoris muscles. The joint actions involved is hip flexion, knee extension, and pelvic stability. Hip flexion occurs when the leg is lifted off the table. Knee extension is shown as the knee is extended during the whole test. Pelvic stability is shown as your pelvis must be in a neutral position during the extension of your leg. Step by step. Start on the ground. Have your participant lay in a supine position on the table with both legs extended. Then have the participant raise the testing leg as high as possible while keeping the knee extended and the non-testing leg. Then measure with an inclinometer on the thigh between the greater trochanter to the lateral epicondyle to receive the degree. Common errors to avoid during this test is bending of the knee and the non-testing leg being lifted off the table. Quantification and analysis. Summary of the results indicate that the participant was well in the normative range, as the range is from 70 to 90 degrees. The participant's left leg was 76 degrees and the right leg was 77 degrees. Even though the participant's numbers were in between the normative data value, for a sprinter, that would be considered a short stride length, as their stride length should be 80 degrees or higher. Some cutoffs for range of motion based on Pliski's research were severe restriction, which was less than 60 degrees, which can indicate a limitation in optimal range of motion, which is 70 to 90 degrees, and this would affect performance. The cutoff for asymmetry is 10%. A landmark that would help with consistency, like mentioned before, would be the greater trochanter. Conclusion. The results above show that there is a balanced flexibility and hip mobility between the left and right legs. With an asymmetry of 1.30%, this won't increase injury risk or impact performance. The next test that we have is the active knee extension test. This test is used to assess your hamstring's flexibility and function. The hamstring starts from the pelvis, specifically the ischial tuberosity, and is distal to the tibia. The knee is flexed and the hip is extended. The gastrocnemius plays a role in the active knee extension test, as it helps keep the ankle in plantar flexion and helps with knee flexion. This test can help with assessing injury prevention, flexibility, and balance. Step by step. Start on the ground. Have the participant lie in a supine position, then flex the testing leg to a 90-degree angle. From the 90-degree angle, extend the knee as far as possible, then place the inclinometer on the thigh to receive the degree. Common errors to avoid during the test will be rotating the pelvis and hip movement. Quantification and analysis. Summary of the results show that the participant is not in the normative range, as the range is between 135 to 145 degrees. The participant results on the left leg was 112 degrees and the right leg was 117 degrees. This shows that the participant has limited flexibility when it comes to knee extension, which means they have tight hamstrings. The normative data value range is 135 to 145 degrees for the active knee extension test. For example, a sport like gymnastics would aim for a higher normative range above 145 degrees, as it is more flexible, as it is a more of a flexibility-focused sport. The asymmetry cut off is 10%. A landmark that would help with consistency is the greater trochanter. Conclusion. The results above indicate that there is a limited knee extension, as both knees fell below the normative range, which is 135 to 145 degrees. The asymmetry being 4.27% can show that there could be compensation for limited range.